Hello, I'm Peggy Henson, councilperson for the 11th District, and I am here with Angela Zeke, who is with Legal Aid of the Bluegrass. And we have some important information that we would like to share with seniors in our community and also individuals who may be receiving Medicare benefits with Social Security disability. So, hello, Angela.
Hello, thank you.
Thank you for being here and sharing what I feel like is very important information that we need to get out there.
Well, we appreciate you giving us this opportunity, so thank you very much.
You're welcome. So tell me, what is SHIP? What does it stand for?
Yeah.
What do our seniors, I know they can really benefit from these services.
That's right.
So can you tell us more?
Absolutely.
Okay.
So SHIP, the word itself doesn't tell you a thing of who we are, what we do, and even if I tell you what the acronym stands for, you're still really not going to know. But SHIP stands for State Health Insurance Assistance Program. We are public benefit advocates. Our goal is to help anyone on Medicare or anyone over the age of 60 with their public benefit issues, focusing specifically on Medicare, but also we work with Medicaid, Social Security, veterans benefits, and everything in between.
Oh, that's good. That's really good to know. So, and I know from what I've read, there are a lot of changes occurring, and among the senior population, there may be some anxiety with that.
Absolutely.
And so you're here to help with that.
That's right.
And to help reduce that anxiety and show them a much easier way.
Yes. That's right. You know, SHIP is funded through the Older Americans Act. So this is federal grant money that we receive. So all services are provided at no cost to our individuals that reside in our 30-county service region. Of course, Fayette is the largest community that county that we cover. But it is our responsibility to know what those changes are, to provide education to Medicare beneficiaries so they understand their benefits and they know what they have access to, but also to inform them of changes that may impact those benefits and what they need to know in the future so they can make good decisions, good informed decisions that impact their health care.
So how does a senior, other than, we're trying to get the word out and through just public information, but if a senior are they notified of this service through the Social Security Administration or?
We do work very closely with Social Security and with Medicare and other government agencies. They will direct individuals to us if they know that there's a problem that we can help to resolve. Typically, our information is sent out in the Medicare and You booklets that individuals will soon receive in their mailbox with information for next calendar year. But we're hidden in the back, and so it is a little bit difficult to know who we are. Unfortunately, with our federal grant money, there isn't a marketing budget, so we rely heavily on public service announcements that we send to newspapers or radios, opportunities like the one you're giving us today, and word of mouth. Yes.
Okay. Well, that's because. Have you also visited our senior center?
Oh, absolutely.
I'm sure
yes.
you have.
We actually have a volunteer that goes there weekly, and him and a member of our staff are there to provide counseling.
So, this program is mainly done with volunteers, correct?
It mainly is, yes. We have, there's a skeletal crew that provides services to the 30 counties, but we have roughly 100 volunteers throughout our 30 counties that provide services. Now, some of those individuals are currently working and they're volunteering through their employer, and then we have individuals who've retired and they've wanted to give back to their community, and they do that by coming coming in and working with clients here in the office or at like the senior center here in Lexington, helping people to navigate the Medicare system, compare their Medicare options, and providing a great deal of education.
Okay, good. Well, I think, the important thing is to get the word out there.
Yes.
And then on our screen, I believe we will have all the contact information, phone numbers, so when seniors, and I do believe that our seniors in our community watch our GTV3.
Yes. Yes.
Now it's channel 185 on cable, but I do believe they watch that, and they'll have the information. And if they're curious, hopefully you'll be swamped with calls.
Yes, we hope so.
And we can help as many people as we possibly can.
Yes, I hope so. We are getting ready to go into Medicare open enrollment that starts October 15th and ends December 7th. That is their time of year to compare that Medicare prescription drug and the Medicare Advantage plan coverage. It's very important that they compare. Typically, when we meet with individuals at our open enrollment events or we're working with them one-on-one, usually about 85 to 90% of the time, there is a cheaper policy that is better for them, that covers their medication, has limited restrictions on the medication. So it's really important to compare that coverage every year. Even if this year it's been great coverage, may not be next year. And also when individuals call us, our goal is to make sure that we are connecting individuals to every benefit that they are eligible to receive. For example, we know that there are thousands of Kentuckians, several thousands here in Fayette County, that are eligible for a benefit called Extra Help. Extra Help lowers the drug plan cost, and it lowers the cost that they pay at the pharmacy for their medication. But people are not tapping into that. And so we make sure that if a person is eligible, we help them to apply. The prescription...
Is that based on income levels?
It is, but it is a very, it's a very relaxed benefit in that it's not as restrictive as some of like the state benefits that we have.
Like Medicaid.
That's right. And so it's really to everyone's advantage to apply for that coverage. And if they are not eligible, our prescription drug benefit as it exists today still has something called the donut hole or the coverage gap. So when people fall into that hole, their out-of-pocket costs at the pharmacy goes up. And so we can help someone apply for the Extra Help benefit, and if they are denied, once they go into that donut hole coverage, if we have that denial, we can get them access to free or reduced medicines from patient assistance programs through the pharmaceutical companies.
Good.
So there are other ways that we try to help individuals to save money, because we know people on Medicare have limited income.
Right.
And so every penny counts. And so what we're trying to do is make sure that people get access to these benefits to really expand their budget so they can afford fresh fruits and vegetables at the grocery store.
Right.
So they're not having to choose between buying their medicines or paying their phone bill.
Right.
So the goal is really, once they get to us, not only to help them understand Medicare,
Right.
And the changes that may be coming, but also giving them more money by connecting them to those other benefit programs.
That's fantastic, because in all honesty, until I was contacted by your office, I didn't know this existed.
Yes.
Of course, I'm not Medicare eligible just yet, but I've
Right.
got a few years. It's knocking on my door, so... But I know that, our population is aging.
Yes.
And more individuals. I'm a baby boomer. The baby boomers are going on to retirement and Social Security. So I know there are a lot of them out there that could
Yes.
certainly benefit. So,
Yes.
and I'm really glad to know that you're here.
Well, thank you.
And that you're offering these services.
Yes, and like I said, our services are at no cost to the individual because of the federal funding that
Right.
we receive. And we also receive some additional funding from United Ways, from the National Council on Aging. So our focus is really the older adult population or the disabled population on
Right.
Medicare, but really just trying to end the suffering, one person at a time.
Well,
So.
thank you very much. Is there anything else you would like to share, or?
Yeah, I would like to just mention that we are housed within legal aid of the Bluegrass.
Okay.
We have an office in Lexington, and we have attorneys on staff that provide a full or a range of services, all relating to civil cases. But for our older adults, we also receive special funding to provide certain legal assistance, powers of attorneys, last wills and testaments, or if they're encountering other issues, landlord-tenant issues or consumer-related issues, our attorneys can evaluate that case and see if we can provide assistance at no cost as well.
That is fantastic.
Yes.
So, thank you very much.
Thank you.
And we'll put all the information on the screen, like I said, and hopefully you'll be bombarded with calls. Okay?
Thank you.